Welcome to our NCLEX Practice Test. This test has 75 questions on topics you'll see in the real exam. These questions will help you better understand the concepts that will be tested on the exam. Let's get started. 1. The heat-regulating center of the brain is the A. Hypothalamus, B. Pituitary gland, C. Pons, D. Medulla oblongata. Correct answer, A. Hypothalamus. The hypothalamus is the heat-regulating center of the brain. It also has control over the pituitary glands, which is the master endocrine gland. 2. The anatomic structure located in the middle of the heart which separates the right and left ventricles is the A. Septum, B. Sputum, C. Separator, D. None of the above. Correct answer, septum. The septum is located in the middle of the heart and separates the right and left sides. Cells of the cardiac conduction system can also be found in this structure. 3. Select the age group that is coupled with an infectious disease that is most common in this age group. A. Infants, high bilirubin. B. Preschool and school-age children, shingles. C. Young adults and teenagers, sexually transmitted diseases. D. The elderly, malaria. Correct answer, C. Young adults and teenagers, sexually transmitted diseases. Young adults and teenagers are at greatest risk for sexually transmitted diseases. High bilirubin is a laboratory finding and not an infectious disease. Preschool and school-age children are not at great risk for shingles, the elderly are. Lastly, old age is not associated with malaria. It is associated with shingles. 4. A nurse is providing information for a woman who is 36 weeks pregnant and who has hepatitis B. Which of the following statements from the client indicates understanding of this condition? A. Now I know I will need a cesarean section. B. My baby will need 2 shots soon after his birth. C. I will not be able to breastfeed. D. My baby's father does not need testing. I know I am the one with hepatitis. Correct answer, B. My baby will need 2 shots soon after his birth. A baby born to a mother with hepatitis B should ideally receive 2 injections following birth to diminish his chances of contracting the disease. Within the first 12 hours following birth, a baby born to a hepatitis B positive mother should receive the first in the series of hepatitis B vaccines. The baby should also receive an injection of hepatitis B immune globulin, HBIG, to provide further protection against the virus. 5. A nurse is caring for a 2-day-old infant who has a bilirubin level of 19 mg per dl. The physician has ordered phototherapy. Which of the following actions indicates correct preparation of the infant for this procedure? A. Undress the baby down to a diaper and hat. B. Place the baby in his mother's arms before turning on the light. C. Position the phototherapy light approximately 3 inches above the baby's skin. D. Secure eye protection for the infant without occluding the nose. Correct answer, D. Secure eye protection for the infant without occluding the nose. Phototherapy is used to treat high levels of bilirubin among infants, typically evidenced as jaundice. The nurse must position the infant carefully during this procedure in order to maximize the benefits of the light therapy while protecting the baby at the same time. The nurse should place protective eyewear over the baby's eyes without occluding the nose, in order to protect the eyes from the ultraviolet light. 6. Mrs. D is a pregnant client who is 33 weeks gestation and is admitted for bright red vaginal bleeding. Her physician suspects placenta previa. All of the following nursing interventions are appropriate for this client except A. Institute complete bed rest for the client. B. Assess uterine tone to determine condition. C. Perform a vaginal exam to assess cervical dilation. D. Measure and record blood loss each shift. Correct answer, C. Perform a vaginal exam to assess cervical dilation. A client with placenta previa has part of the placenta covering some or all of the cervical opening. A vaginal exam for placenta previa may cause significant bleeding and should be avoided unless directed by a physician and preparations are made for emergency delivery. 7a. Nurse is caring for Mrs. L, a pregnant client who is 35 weeks gestation. The client complains of abdominal pain, her abdomen is rigid and she has little vaginal bleeding. The nurse notes few fetal accelerations on the fetal monitor. Which of the following conditions most likely describes these symptoms? A. Placenta previa. B. Prolapsed cord. C. Preeclampsia. D. Abruptio placentae. Correct answer, D. Abruptio placentae. Abruptio placentae occurs when the placenta separates from the wall of the uterus before the baby is delivered. A clot may form between the placenta and the uterine wall, causing internal bleeding that may not be outwardly apparent. Signs and symptoms of abruptio placentae include a rigid, board-like abdomen, increased fundal height, little vaginal bleeding or discharge, and late decelerations on the fetal monitor. 8. Mrs. L's blood pressure has dropped to 86/58 and her heart rate is 112 bpm. Based on her assessment, what is the most appropriate action of the nurse? A. Insert 2 large bore IVs. B. Elevate the head of the bed. C. Insert an indwelling catheter. D. Both A and C. Correct answer, D. Both A and C. Depending on the amount of bleeding, abruptio placentae can be life-threatening to both the mother and the fetus because of fluid loss. The nurse should insert 2 large bore IVs in order to administer fluids and blood products if ordered. Mrs. L is showing symptoms of hypovolemia based on her vital sign changes. Because she is 35 weeks gestation, the nurse should insert an indwelling catheter for prompt cesarean delivery. 9. A nurse is performing an education session to a group of middle-aged adults on prevention of osteoporosis. Which of the following statements made by the client indicates they need further teaching regarding prevention of osteoporosis? A. I should discuss taking calcium and vitamin D supplements with my doctor. B. I should participate in 30 minutes of swimming most days of the week. C. I should participate in 30 minutes of walking most days of the week. D. I should discuss a bone density scan, DXA, with my physician. Correct answer, B. I should participate in 30 minutes of swimming most days of the week. Swimming is a non-weight-bearing activity, therefore it does not contribute to bone density. Walking or running are good examples of weight-bearing exercises that decrease the risk of bone loss. Calcium and vitamin D supplements may help slow bone loss. 10. A patient presents with vesicles covering the upper torso. Which of the following situations could cause this condition? A. Knife fight. B. Auto accident. C. Sunburn. D. Fungal infection. Correct answer, C. Sunburn. Vesicles is the medical term for blisters. A second-degree sunburn could blister, forming vesicles over the affected area. 11. A client is being admitted to the stroke care unit of a rehabilitation center. Which of the following best describes the action of the nurse at admission? A. Collect and arrange documents to be placed in the client's medical record. B. Prepare the client's identification bracelet. C. Identify pertinent health history data as well as current needs and limitations. D. Gather the client's valuables and place them in a locked container. Correct answer, C. Identify pertinent health history data as well as current needs and limitations. Upon admission to a new care unit, the nurse's initial responsibility is to assess the client and identify any pertinent health history data that will affect his care. The nurse should also assess the client's needs and limitations, which allows her to formulate a nursing diagnosis as well as establish outcomes for this client while in her care. 12. A client is refusing to undergo any more treatments in the hospital and wants to leave against medical advice. When the nurse requests the client sign an AMA order, the client refuses and leaves. What is the next action of the nurse? A. Call security to hold the client until he will sign the order. B. Notify the physician to convince the client that he needs to stay. C. Speak with the client's spouse to persuade him to stay. D. Allow the client to leave and document the refusal in his chart. Correct answer: D. Allow the client to leave and document the refusal in his chart. The nurse cannot force the client to stay in the hospital to receive treatment or even to sign an AMA order. While she may try to use the physician or spouse to convince the client to stay, ultimately, the nurse should clarify the situation and document the client's refusal to sign the AMA form and file it in the chart. 13th, the case manager is determining the discharge needs of a patient on a medical surgical floor in an acute care hospital. The patient is a 55-year-old male that was admitted to the hospital following a fall at work in which he suffered a left femur fracture. His past medical history includes CHF, COPD, DMI, and HTN. Which discipline's assessment would be a priority in determining the level of care needs for this patient? A. Nursing. B. Occupational therapy. C. Physical therapy. D. All of the above. Correct answer: D. All of the above. All of the above are correct. Nursing assessment would be important to determine the wound care needs upon discharge. Occupational therapy assessment would be important in determining the adaptive devices necessary to perform ADLs. Physical therapy assessment would be important in determining the strength of the patient and ability to return to optimum functionality. 14. Which example best describes a nurse who exhibits moral courage? A. A nurse feels angry when a parent refuses important treatment for his child. B. A nurse considers seeking help for depression when she feels she cannot meet the needs of her clients in the oncology unit. C. A nurse contacts a physician for further orders when he fails to order comfort measures for a client with a terminal illness. D. A nurse is frustrated when the laboratory is slow in responding to an order for a stat. Blood glucose. Correct answer: C. A nurse contacts a physician for further orders when he fails to order comfort measures for a client with a terminal illness. Moral courage involves taking action to do what is right, even when there might be negative consequences. The nurse who contacted a physician for further orders acted as a client advocate to seek help, even though she may have faced such consequences as lost time, decreased productivity, or criticism from the physician. 15. Which method is most appropriate for managing moral distress in the workplace? A. Recognizing that life is unfair and nurses cannot meet every need of every client. B. Declining to act when clients or visitors make requests that are not justifiable. C. Developing a new policy that would address the problematic situation. D. Both A and B. Correct answer: C. Developing a new policy that would address the problematic situation. Moral distress involves negative feelings or frustration toward situations that are deemed unfair, unethical, or that cause the nurse to feel helpless in her work. Moral distress can lead to nurse burnout when ongoing issues are not resolved. A nurse can work to manage moral distress by not only recognizing the potential for its development, but also creating policies that may help to change current standards, which can reduce the number of situations that create moral distress. 16. A nurse is required to float to another unit within the hospital where he is asked to care for a client on a ventilator. The nurse is uncomfortable with this assignment, as he has not had a ventilated client since nursing school. What is the nurse's most appropriate response? A. Explain to the nursing supervisor the level of discomfort and ask for a different assignment. B. State that the client's needs are outside the nurse's scope of practice and request a different assignment. C. Accept the assignment, asking for help when necessary. D. Request to return to the home unit and send another nurse who can perform the job. Correct answer: A. Explain to the nursing supervisor the level of discomfort and ask for a different assignment. When floating to another unit and asked to take an assignment that falls outside a nurse's comfort zone, the nurse should notify the area supervisor of the level of discomfort and request a different assignment. Caring for ventilated clients typically falls within the scope of nursing practice. However, discomfort with the situation may not necessarily be overcome by accepting the assignment. Alternatively, the effects could be harmful to the client if the nurse is unfamiliar with this type of care. 17. A nurse is asked to perform a task that she believes is outside her scope of practice. What is the appropriate response to this issue? A. Contact the State Board of Nursing Licensure to report the offense. B. Review the state scope of practice standards for nurses. C. Ask another nurse to perform the task to learn the procedure. D. Contact the house supervisor to make the decision as to whether the nurse should perform the task. Correct answer: B. Review the state scope of practice standards for nurses. There may be times when it is unclear if certain practice standards fall within the nursing scope of practice. Because guidelines vary between states, the nurse should review the scope of practice for nurses for this particular state to discern whether the action is permissible. If it is not possible to check the scope of standards herself, or if the standards are unclear, the nurse should then contact a supervisor. 18. The staff on a postpartum unit has been complaining to the nurse manager about certain nurses not fulfilling the required weekend shifts. To address the problem, the nurse manager implements new staffing guidelines that would require each nurse to work 4 weekend shifts per month. The implementation of these guidelines is an example of the following leadership style: laissez-faire leadership. B. Authoritarian leadership. C. Democratic leadership. D. Servant leadership. Correct answer: B. Authoritarian leadership. The implementation of the staffing guidelines without any input from the staff is an example of authoritarian leadership. Often with this leadership style, punishment and negative reinforcement are used to implement rules. This style is often not well received by staff. 19. A nursing unit is implementing a new electronic charting program for the nursing staff to use. Which of the following best describes a disadvantage of using electronic charting? A. The information is more likely to be lost or used inappropriately. B. Any provider in the unit can have access to the client's medical records. C. The system diminishes communication between nurses and providers. D. The program may be confusing and difficult to implement. Correct answer: D. The program may be confusing and difficult to implement. A disadvantage to implementing a new form of electronic health charting on a unit is the complexity of the system involved. Starting a new system and expecting all staff to use it appropriately may take time and education for everyone involved. The system may cause confusion while all users practice learning how to navigate charting techniques. 20. A client has volunteered to take part in a research study. After participating for 2 months, he decides that he can no longer tolerate the study and decides to leave. What are the client's rights in this situation? A. The client has a right to be released from the study but must reimburse the researchers for charges incurred. B. The client has a right to be released from the study without any liability. C. The client has a right to be released from the study but is prohibited from participating in any future studies. D. The client does not have the right to be released from the study, he must finish his participation. Correct answer: B. The client has a right to be released from the study without any liability. If a client chooses to take part in a research study and then decides that he no longer wants to be involved, he may withdraw from the study at his own right. Forcing a voluntary study participant to remain in a research study violates his personal rights. 21. A client is seen in the emergency room as a victim of suspected domestic violence. The nurse's aide brings the client to a center curtained area, gives her a gown to change into, and asks her to wait for the nurse. What is the most appropriate action of the nurse upon arrival? A. Ask the client to undress to visualize any injuries. B. Take the client into a private room. C. Notify the police to file an initial report. D. Notify the house supervisor to keep security on alert. Correct answer, B. Take the client into a private room. A client who is seen as a possible victim of domestic violence should be given privacy in a safe room or location. Until the nurse can discern whether the case is the result of abuse or that the situation is unsafe, she should refrain from notifying authorities until she has more information. 22. Which of the following abbreviations is acceptable to use as part of medication documentation? A. QOD. B. Ms. C. IU. D. PRN. Correct answer, D. PRN. Writing PRN after a medication dose indicates that a medication may be given on an as-needed basis. This requires the nurse to use her judgment when administering medications. There may also be a maximum amount that can be given. There have been many abbreviations that are listed as unacceptable, as they may cause confusion and should instead be written out. 23. How many milliliters are equal to 1 quart of fluid? A. 250 milliliters, B. 500 milliliters, C. 1000 milliliters, D. 2000 milliliters. Correct answer, C. 1000 milliliters. 1 quart of fluid is equal to 1000 milliliters. The nurse should be aware of fluid volumes when administering intravenous fluids and medications. In some situations, the apothecary system of 1 quart must be converted to milliliters. 24. A nurse receives an order for ionsoprazole, Prevacid, 15 mg daily. The medication is available in syrup form of 5 mg per milliliter. How many milliliters must this nurse give? A. 5 milliliters, B. 1 milliliter, C. 3 milliliters, D. 15 milliliters. Correct answer, C. 3 milliliters. When calculating drug dosages, the nurse must determine how many milligrams are available per milliliter and multiply to reach the correct dose. In this example, 5 milligrams of Prevacid is available in 1 milliliter of fluid. Multiplying 5 milligrams x 3 milliliters equals 15 milligrams, 25. A nurse asks her coworker to administer Mr. J's 12 p.m. medication because she is running behind. Which of the following information must the nurse verify with Mr. J before giving him his medication? A. His name and address. B. His name and hospital identification number. C. His name and room number. D. His name and diagnosis. Correct answer, B. His name and hospital identification number. To avoid mistakes in medication administration, the nurse should verify the client's name and hospital identification number before giving a drug. This information is usually available on a client's identification band when in the hospital. Verification should be done on all clients but is especially important in those situations when the client is previously unknown to the nurse. 26. Which of the following is more likely to occur with aging as a complication of medication administration? A. Increased renal function. B. Increased gastrointestinal absorption. C. Increased visual acuity. D. Increased ratio of fat compared to lean body mass. Correct answer, D. Increased ratio of fat compared to lean body mass. Aging adults develop an increased ratio of fat to lean body mass, which affects how their bodies process medications. Increased fat tissues may cause the body to retain fat-soluble medications, which in turn places the older adult at risk of drug toxicity. 27. Which of the following interventions should the nurse consider when giving an oral medication to a child? A. Mix the medication with milk to mask the taste. B. Dilute the medication in a glass of water. C. Refeed the medication if the child pushes it out with his tongue. D. Mix the medication in a food the child enjoys. Correct answer, C. Refeed the medication if the child pushes it out with his tongue. When administering oral medications to a child, he may not want to cooperate with taking the medicine, particularly if the flavor is unpleasant. Small children who push medication back using their tongues can be refed the medication as long as it stays on or near the spoon or cup. Avoid mixing medications with a child's favorite foods, as unpleasant medications may create a negative association with the food. 28. Which of the following methods best describes administration of an intradermal injection? A. Pull the skin taut and insert the needle bevel up just slightly under the skin. Inject medication to create a wheal. B. Pull the skin taut and insert the needle bevel down just slightly under the skin. Inject medication to create a wheal. C. Pinch the skin and insert the needle bevel down into the skin fold to create a wheal. D. Pinch the skin and insert the needle bevel up at a 45-degree angle into the skin. Correct answer. Pull the skin taut and insert the needle bevel up just slightly under the skin. Inject medication to create a wheal. When administering an intradermal medication, the nurse uses a fine-gauge needle and inserts it, bevel up, into the dermis layer of the skin. The nurse should pull the skin taut before injection to facilitate easy needle entry. Producing a wheal verifies that the medication is in the dermis and not the subcutaneous fat. 29. Which of the following is a disadvantage of administering intravenous medications through the 4-push method? A. It is impossible to determine the full effect of the drug on the client. B. The drug may be irritating to the client's veins. C. The peak onset of action is slower when a drug is given 4-push. D. None of the above. Correct answer. B. The drug may be irritating to the client's veins. A disadvantage of giving medications through 4-push is that the medicine quickly enters the bloodstream and may be irritating to the client's veins. The nurse must be aware of the effects of the medication on the client's circulation as well as the medication's purposes. Once a drug has been given 4-push, it cannot be taken back, so the nurse must always remain aware of what and how much she is giving. 30. A nurse is preparing to administer an ophthalmic medication to Mrs. W. Which of the following statements demonstrates that the nurse is performing this procedure correctly? A. Open your eyes wide and look toward the floor. B. I will hold your eyelashes to keep your eye open. C. I'm going to give this drop in the lower part of your eye. D. Try to keep your eyes open after I give this medicine. Correct answer. C. I'm going to give this drop in the lower part of your eye. A nurse who is administering ophthalmic medications should instruct the client to look up while she holds the eye open by pulling the lower eyelid down toward the cheekbone. The medication should be instilled into the lower conjunctiva and the client instructed to close her eyes just following the drops to distribute the medication. 31. Which of the following effects does obesity have on drug distribution? A. Drugs are distributed more quickly in obese persons because blood flow is increased through fat tissue. B. Drugs are distributed more slowly in obese persons because blood flow is decreased through fat tissue. C. Obesity has a paradoxical effect on drug distribution in that blood flow is decreased but distribution is increased. D. Obesity has no effect on drug distribution. Correct answer. B. Drugs are distributed more slowly in obese persons because blood flow is decreased through fat tissue. Obese persons may have slower levels of drug distribution after taking medications. Blood travels more slowly through fat tissues and increased amounts of fatty tissues further hampers the distribution of the drug throughout the body. The obese person may have to wait a greater amount of time after taking a drug for it to be released. 32. Which of the following is a potential side effect of ibuprofen? A. Headache. B. Urinary retention. C. Hematuria. D. Low blood pressure. Correct answer. C. Hematuria. Hematuria may be a side effect of ibuprofen. This type of drug is a non-steroidal anti-inflammatory drug, NSAID, which may be more likely to cause small amounts of bleeding. Nurses should consider clients' urinary output, as well as monitor liver enzymes and gastrointestinal function before administering ibuprofen. 33. An 85-year-old client is diagnosed with hypernatremia due to lack of fluid intake and dehydration. The nurse knows that symptoms of hypernatremia include lack of thirst, B. Pale skin, C. Hypertension, D. Swollen tongue. Correct answer, D. Swollen tongue. Hypernatremia among elderly clients may be caused by dehydration and lack of fluid intake. Hypernatremia results in sodium levels greater than 145 milliequivalent/L. The most common symptoms of this condition are mental status changes, a thick or swollen tongue, excessive thirst, and flushed skin. 34. A client is brought into the emergency department after finishing a course of antibiotics for a urinary tract infection. The client is experiencing dyspnea, chest tightness, and is agitated. Her blood pressure is 88/58. She has generalized hives over the course of her body and her lips and tongue are swollen. After the nurse calls for help, what is the next appropriate action? A. Start N4 and administer a 1-liter bolus of lactated Ringer's solution. B. Administer 0.3 mg of 1:1000 epinephrine IM. C. Administer 15 mg diphenhydramine IM. D. Monitor the client until help arrives. Correct answer, B. Administer 0.3 mg of 1:1000 epinephrine IM. A client experiencing an anaphylactic reaction will most likely present with rash or hives, swelling of the lips, face, or tongue, hypotension, or dyspnea. A client who is experiencing breathing difficulties should rapidly be given an intramuscular injection of 0.3 mg of 1:1000 epinephrine to relax the muscles of the airway and facilitate better breathing and increased oxygenation. 35. A nurse is assessing a client who is post-op day number 3 after an abdominal hernia repair. After a bout of harsh coughing, the client states, "It feels like something gave way." The nurse assesses his abdomen and notes an evisceration from the surgical site. What is the next action of the nurse? A. Turn the client on his side. B. Push the abdominal contents back inside the wound using sterile gloves. C. Ask the client to take a breath and hold it. D. Cover the intestine with sterile saline dressings. Correct answer, D. Cover the intestine with sterile saline dressings. A wound evisceration occurs when the edges of an abdominal wound separate, allowing the coils of the intestine to protrude outside of the body. The nurse should notify the physician at once if this occurs. While waiting for treatment, the nurse should cover the intestines with sterile gauze soaked in saline. 36. A nurse is performing CPR on a client when a coworker brings an automated external defibrillator, AED. The nurse prepares to apply the patches to the client's chest when she notes that he has a large amount of thick chest hair. What is the next action of the nurse? A. Apply the pads to the chest and provide a shock. B. Wipe the client's chest down with a towel before applying the pads. C. Shave the client's chest to remove the hair. D. Do not use the AED. Correct answer, C. Shave the client's chest to remove the hair. In most cases, AED pads will adhere to a client's chest, even if he has chest hair. In cases of thick chest hair, however, the AED pads may not conduct current properly. Many AED kits contain a razor, allowing the nurse to shave the area of the chest to apply the pad. The nurse should act quickly and limit time spent preparing the client. 37. A nurse is educating a client who was recently diagnosed with diverticulosis. What types of foods should the nurse recommend for this client? A. Whole grain cereal. B. Eggs. C. Cottage cheese. D. Fish. Correct answer, A. Whole grain cereal. A client with diverticulosis has a condition that causes small protrusions in the intestinal tract. If the protrusions become infected or inflamed, the condition is called diverticulitis. Diverticulosis can be managed by a high-fiber diet, and the nurse should recommend foods that contain fiber such as whole-grain cereal, fruit, such as apples or prunes, or vegetables, including beans, squash, or cauliflower. 38. A client is brought into the emergency room where the physician suspects that he has cardiac tamponade. Based on this diagnosis, the nurse would expect to see which of the following signs or symptoms in this client. A. Fever, fatigue, malaise. B. Hypotension and distended neck veins. C. Cough and hemoptysis. D. Numbness and tingling in the extremities. Correct answer: B. Hypotension and distended neck veins. Cardiac tamponade occurs when fluid or blood accumulates in the pericardium, preventing the heart from contracting properly. Cardiac tamponade results in decreased cardiac output and is a medical emergency. Symptoms of this condition include low blood pressure, distended neck veins, chest pain, and muffled heart sounds. 39. Which of the following descriptions best describes the function of the thyroid gland? A. The thyroid gland converts glucose into glycogen. B. The thyroid hormone secretes cortisol during times of stress. C. The thyroid gland regulates body metabolism. D. The thyroid gland affects skin pigmentation. Correct answer: C. The thyroid gland regulates body metabolism. The thyroid gland is responsible for secreting thyroxine, T4, and triiodothyronine, T3, which work to regulate metabolism of the body's cells. The thyroid also regulates carbohydrate, protein, and fat metabolism, as well as regulates both physical and mental development. 40. A client in the ICU has been intubated and placed on a ventilator. The physician orders synchronous intermittent mandatory ventilation (SIMV). Which statement best describes the work of this mode of ventilation? A. The ventilator delivers a set rate and tidal volume regardless of whether the client is attempting to breathe. B. The ventilator coordinates delivered breaths with the client's respiratory efforts. C. The ventilator provides a supplemental breath for every third breath of the client. D. The ventilator provides breaths during the expiratory phase of the client's respirations. Correct answer: B. The ventilator coordinates delivered breaths with the client's respiratory efforts. Synchronous intermittent mandatory ventilation, SIMV, is a ventilation mode that coordinates delivered breaths with the client's own respiratory efforts. The delivered breaths from the ventilator have preset pressures as ordered by the physician. This type of ventilation may be used among clients as a standard form of ventilation or to wean from the ventilator. 41. A client is seen for testing to rule out Rocky Mountain spotted fever. Which of the following signs or symptoms is associated with this condition? A. Fever and rash. B. Circumoral cyanosis. C. Elevated glucose levels. D. All of the above. E. Both A and D only. Correct answer: fever and rash. Rocky Mountain spotted fever, RMSP, is caused by the R. rickettsia pathogen and causes damage to the blood vessels. A person with RMSP may present with fever, edema, and a rash that starts in the hands and feet and then spreads throughout the body. The condition starts after a bite from an infected tick. 42. A nurse is caring for a newborn infant in the nursery who has developed vomiting, poor feeding, lethargy, and respiratory distress. The physician has diagnosed this infant with necrotizing enterocolitis. Which of the following nursing interventions is most appropriate for this infant? A. Feed the infant 30 cubic centimeters of sterile water. B. Position the infant on his back. C. Administer antibiotics as ordered. D. Allow the infant to breastfeed. Correct answer: C. Administer antibiotics as ordered. Necrotizing enterocolitis, NEC, occurs when part of the bowel becomes ischemic, causing gastrointestinal problems, periods of apnea, lethargy, and poor feeding, and potentially sepsis and death. A nurse caring for an infant with NEC should stop oral feedings, insert a nasogastric tube, and administer antibiotics as ordered. 43. A nurse is coming onto her shift at 0700 and is assigned 4 patients on an orthopedic medical surgical unit. The first patient is post-op day 2 from a left knee replacement and has had uncontrolled pain through the night, rating the pain 9/10. The second patient is post-op day 1 and ordered an antibiotic for at 0730. The third patient has physical therapy at 0800 and is requesting pain medication 1 hour before therapy. The fourth patient is complaining of SOB and hematemesis. Which patient would the nurse see first? A. First patient. B. Second patient. C. Third patient. D. Fourth patient. Correct answer, D. Fourth patient. The nurse would see the fourth patient first because SOB and hematemesis are signs indicative of a pulmonary emboli, which can be a potentially life-threatening situation where blood flow to the pulmonary arteries are occluded. Although pain management and timely administration of antibiotics are important, they are not the priority in this scenario. 44. Which of the following signs or symptoms indicates a possible nutritional deficiency? A. Subcutaneous fat at the waist and abdomen. B. Presence of papillae on the surface of the tongue. C. Straight arms and legs. D. Pale conjunctiva. Correct answer, D. Pale conjunctiva. A client with poor nutritional intake may have pale mucous membranes surrounding the eye, or the conjunctiva. This area should normally be pink, indicating good circulation and a lack of irritation or dryness. Improper nutrition can manifest as numerous signs in the body, including bowed legs, pale mucous membranes, a smooth or beefy tongue, and poor muscle tone. 45. A nurse is preparing to insert a small-bore nasogastric feeding tube for a client's enteral feedings. In which method does the nurse measure the correct length of the tube? A. From the tip of the nose to the xiphoid process. B. From the tip of the nose to the earlobe to the xiphoid process. C. From the earlobe to the xiphoid process. D. From the tip of the nose to the earlobe to the umbilicus. Correct answer, B. From the tip of the nose to the earlobe to the xiphoid process. When preparing to insert a nasogastric tube, the nurse must measure for the correct length to ensure that the end of the tube will be in the correct position in the stomach. To gauge the correct length, the nurse should measure from the tip of the nose to the earlobe to the xiphoid process. This length puts the end of the tube in the stomach, rather than the small intestine or esophagus. 46. In which of the following ways can a nurse promote sleep for a client who is experiencing insomnia? A. Assist the client to use the bathroom 1 hour after going to bed. B. Give the client a massage after he wakes up in the morning. C. Tuck bed sheets and blankets tightly around the client once he is settled in bed. D. Give the client a pair of socks to wear if his feet become cold. Correct answer, D. Give the client a pair of socks to wear if his feet become cold. A nurse can promote sleep for a client who suffers from insomnia by removing any barriers that may contribute to sleeplessness. If a client develops cold feet, the nurse can give him a pair of socks or an extra blanket to keep his feet warm. Caring for small measures such as these may make a difference in a client's comfort level, promoting sleep. 47. A nurse is preparing to irrigate a client's colostomy. Which of the following situations is a contraindication for this type of irrigation? A. The client has an incontinent ostomy. B. The client has an irregular bowel routine. C. The client has diverticulitis. D. The colostomy bag contains fecal material. Correct answer, C. The client has diverticulitis. A client with a colostomy may need irrigation of the site on a regular basis to clear gas from the colon and reduce odor. There are some situations, however, when irrigation is contraindicated, such as when the client has a gastrointestinal illness that would be exacerbated by irrigation, such as diverticulitis. 48. Family members of a patient ask repeated questions about the monitors and various readings in the patient's room. What is the most supportive response to their questions? A. Inform them that you cannot take the time to answer all their questions. B. Provide detailed explanations for each device. C. Tell them it's too technical to explain. D. Provide an overview and encourage them to spend their time with the patient. Correct answer: D. Provide an overview and encourage them to spend their time with the patient. Addressing the family's questions and providing an overview of information validates their concerns and addresses their requests. Limiting details and encouraging them to focus on the patient helps to avoid anxiety, which could be created by focusing on values that should be interpreted in the context of the patient's situation by professionals with experience with such data. It also encourages them to provide what they uniquely have to offer, a comforting presence for their loved one. 49. The mother of a 3-year-old pediatric patient would like to remain at the patient's bedside throughout the night. The patient seems to be calmer when she is present. What is the most caring and appropriate response? A. Reinforce visiting hours. B. Allow her to stay for a short period beyond normal hours. C. Allow her to stay throughout the night. D. Offer to get bedding for a couch in the waiting room. Correct answer: C. Allow her to stay throughout the night. Allowing the mother to stay throughout the night is the most caring and appropriate response. Most pediatric facilities recognize the vital role the parent plays in the patient's care and are supportive of unlimited visitation. Providing supportive understanding of the needs of both the patient and mother will enhance rapport and cooperation. 50. You are caring for a Hispanic patient who is scheduled for surgery in the morning. A member of the surgery staff is in a hurry when she visits the patient to obtain surgical consent. You know that the patient speaks limited English and can see that he does not really understand what's being said. What is the most appropriate next action? A. Call a family member to interpret. B. Consult the hospital translator to assist. C. Allow the consent to be signed. D. Ask the staff member to come back later. Correct answer: B. Consult the hospital translator to assist. Consulting the hospital translator is the most reliable means of ensuring accuracy in the information that the patient is receiving. Family members can be helpful, but may have difficulty understanding the medical procedures well enough to explain them, and may skew the message being delivered, depending on their view of the situation. Translator collaboration is vitally important to ensure that language barriers do not adversely affect patient care. 51. Brandon is a 38-year-old with a history of cocaine addiction who has just been admitted for his second myocardial infarction that was due to cocaine use. What collaborative process should begin as soon as Brandon is stable enough to interact with additional resources? A. Law enforcement for further prevention. B. Social services for rehab. C. Narcotics Anonymous. D. Financial counselor to apply for assistance. Correct answer: B. Social services for rehab. After stabilization, Brandon should be connected with additional resources to help him deal with his addiction. Social services is an excellent collaborative partner, as these professionals have access to available resources in the community that would be helpful for Brandon's issues. 52. A nurse is providing care for a patient on a medical surgical unit who was admitted for nausea and abdominal pain. The patient states, "These symptoms have been occurring on and off for months and nobody knows what is wrong with me." The patient then becomes upset, begins crying, and breathing rapidly. The nurse recognizes that the patient is upset and is experiencing anxiety. What is the most appropriate nursing intervention? A. State to the patient, "You appear anxious, can you tell me why?" B. Facilitate pursed lip breathing. C. Facilitate meditation with the patient. D. Administer the PRN anti-anxiety medication that is ordered for the patient. Correct answer: B. Facilitate pursed lip breathing. The most appropriate intervention by the nurse would be to facilitate pursed lip breathing to help calm the patient. Pursed lip breathing is a breathing exercise used to decrease rapid breathing and increase relaxation in patients experiencing anxiety. The nurse would facilitate therapeutic communication once her respirations have slowed and the patient has become calm. 53. What consideration is important when caring for a female Muslim patient? A. Make eye contact. B. Provide long-sleeve gowns or allow her to use her own. C. Touch while talking. D. Assign male caregivers when possible. Correct answer: B. Provide long-sleeve gowns or allow her to use her own. Most Muslim women are very conscious of covering their whole body and may want to remain clothed during examinations. Long gowns with long sleeves should be provided, or the patient should be permitted to use her own. Additional considerations are the avoidance of eye contact, not touching while talking, and assigning female caregivers. If a male caregiver or male physician must work with the patient, the husband may request to be in the room. 54. Of the following, what is an important component of Vietnamese culture to consider when teaching the Vietnamese patient who has been treated for pneumonia, who needs to complete her antibiotic regimen at home? A. Cupping will help to pull toxins from the body. B. Coining will help to release the wind or bad energy from the body. C. Once symptoms disappear, there is no longer an illness. D. Most households consist of at least 3 generations. Correct answer: C. Once symptoms disappear, there is no longer an illness. The Vietnamese tend to believe that once symptoms disappear, there is no longer an illness that needs to be treated. Therefore, discharge teaching regarding completing oral antibiotic therapy needs to include this understanding with a delicate approach to optimize treatment completion. 55. If you are caring for a patient of the Hindu culture, what may you anticipate regarding visitors? F. Limited visitors, respectful of privacy. B. Family members only. C. Large number of visitors/community support. D. None of the above. Correct answer: C. Large number of visitors/community support. The Hindu community is very supportive of its members, and large numbers of visitors often come to see the patient at the hospital. Although this may seem inconvenient, appropriate accommodations as possible should be made, since the patient will generally receive benefit from this level of support. 56. You are attempting to teach the wife of a Greek patient how to administer his gastrostomy tube feedings once he returns home. She smiles and nods through your explanations, but when you ask her for a return demonstration, she looks confused and shakes her head. Her daughter enters the room and states that she does not speak English. What would be most helpful in this situation? A. Teach the daughter instead. B. Teach both and ask the daughter to translate for you. C. Contact a home health agency to provide care. D. Provide a pamphlet with detailed instructions. Correct answer: B. Teach both and ask the daughter to translate for you. Teaching both the patient's wife and the daughter is the best option, since the daughter may not always be available and the wife is eager to care for her husband at home. Although a hospital interpreter is often preferred, asking the daughter to interpret is a good option, as she will receive instruction and reinforce it for herself as she is translating it to her mother. 57. A nurse is providing discharge instructions for a client who had back surgery. All of the following exhibit that the client is ready for discharge except the client still has sutures at the incision site. B. The client is able to take a shower. C. The client must still use an ice pack at the wound site. D. The client has a temperature of 100.8 F. Correct answer: D. The client has a temperature of 100.8 F. While providing discharge teaching for a client who is ready to go home, the nurse must assess that there are no signs or symptoms of emerging illness or failure to heal adequately before sending the client home. A nurse dismissing a client with a post-operative temperature of 100.8 degrees Fahrenheit should contact the physician to ensure the client is not developing an infection. 58. A patient is having a colposcopy procedure performed. How should the patient be instructed to prepare for the procedure? A. NPO for 8 to 12 hours before the procedure. B. D/C all HTNRX for 2 days prior to the procedure. C. Take 3 Dulcolax tablets and 2 containers of Miralax the day before to clear out the lower GI system. D. None of the above prep is necessary for this type of procedure. Correct answer: D. None of the above prep is necessary for this type of procedure. A colposcopy procedure is done to view the vagina and cervix. The only preparation that is necessary is to wash the external genitals with soap and water the morning before the procedure. 59. Which of the following conditions may cause an increased respiratory rate? A. Stooped posture. B. Narcotic analgesics. C. Injury to the brain stem. D. Anemia. Correct answer: D. Anemia. A client who has anemia has decreased levels of hemoglobin in the red blood cells. Because hemoglobin is responsible for carrying oxygen molecules to the body's tissues, the client may need to breathe faster to bring in more oxygen to make up for this deficit. 60. A nurse is attempting to check a blood pressure on a client when she realizes that the cuff is too wide for the size of his arm. What type of reading might this blood pressure cuff produce? A. A normal result. B. An abnormally low reading. C. An abnormally high reading. D. A low reading, followed by a normal reading. Correct answer: B. An abnormally low reading. A blood pressure cuff that is too large for the size of a client's arm may produce an abnormally low blood pressure result. The cuff should be placed to appropriately fit the size of the client's arm. If a nurse gets an abnormally low blood pressure reading in a client who is not symptomatic, she should check the size of the cuff. 61. A nurse is caring for a client who has just come from surgery and is in the recovery room. The client still has an endotracheal tube in place. The nurse deflates the cuff on the tube and pulls it out, at which time the client sits up in bed, grasps his throat, and begins to make wheezing sounds. Which of the following conditions is the most likely cause of this situation? A. The client is choking on part of the tube. B. The client has anxiety. C. The client is having a laryngospasm. D. The client is having a normal response from anesthesia. Correct answer: C. The client is having a laryngospasm. Some clients, after being intubated and receiving medications through anesthesia for surgery, may develop a laryngospasm during the time period of emergence from anesthesia. A laryngospasm results in occlusion of the laryngeal opening after a spasm of the vocal cords. The nurse should emergently open the airway to facilitate breathing and administer muscle relaxants if ordered. 62. A client with adrenal insufficiency has a potassium level of 7.2 milliequivalent/L. Which of the following signs or symptoms might the client exhibit with this result? A. Peaked T waves on the ECG. B. Muscle spasms. C. Constipation. D. A prominent U wave on the ECG. Correct answer: Peaked T waves on the ECG. A client with hyperkalemia may exhibit peaked T waves on an electrocardiogram. This manifestation is an early sign of high potassium levels, but diagnosis should not be based on this aspect alone. Untreated hyperkalemia can lead to progressively worsening cardiac instability. 63. A nurse is assisting Mrs. K, a client who is undergoing a lumbar puncture. Which of the following elements should the nurse use to instruct Mrs. K about this procedure? A. A lumbar puncture takes a sample of blood from the back, which will be analyzed by the lab. B. The physician will insert a needle at the level of L4, L5 in the spinal cord. C. Mrs. K should lie flat on her back for 24 hours following the procedure. D. Now. Risks of the procedure include nausea, rash, and hypotension. Correct answer: B. The physician will insert a needle at the level of L4, L5 in the spinal cord. A lumbar puncture is used to draw cerebrospinal fluid to check for potential infection, hemorrhage, or other conditions that can cause a client's illness. The nurse should instruct the client to lie on her side or to sit leaning over a table with her back rounded. The physician will insert a needle into the back at about the level of the L4, L5 vertebral spines. 64. A nurse is caring for a client who has a right-sided chest tube. The chest tube shows 50 cubic centimeters of serosanguinous fluid in the collection chamber and air bubbles are collecting in the water seal chamber. Which action is most appropriate for the nurse at this time? A. Do nothing. This is a normal response. B. Strip the tubing to remove any clots. C. Place a clamp on the tube near the client's chest. D. Remove the collection chamber and connect the tubing to a new device. Correct answer, C. Place a clamp on the tube near the client's chest. The water seal of a chest tube is designed to act as a one-way valve. Air bubbles that are present in the water seal indicate the occurrence of a leak somewhere between the client and the chamber. The nurse should briefly clamp the tube near the client's chest to identify the source of the leak. Once the leak is identified, the nurse should unclamp the tubing and notify the physician right away. 65. A nurse is caring for a client with a broken femur who is in a traction splint in bed. All of the following interventions are part of care of this client except palpating the temperature of both feet. B. Evaluating pulses bilaterally. C. Turning the client to a side-lying position. D. Relieving heel pressure by placing a pillow under the foot. Correct answer, C. Turning the client to a side-lying position. A client who has been placed in traction for a fracture of a large bone such as a femur will be unlikely to turn to a side-lying position while in bed. A client with this type of injury is at risk of skin breakdown and the nurse should attempt to reposition and relieve pressure on certain points that are more likely to have diminished circulation. Safety and infection control 66. You will be escorting a patient to the operating room on a stretcher. In order to prevent this patient from falling, you must do which of the following? A. Make sure the locks are not locked as you move the patient onto the stretcher from the bed. B. Use a safety belt or strap on the patient throughout their escort to the operating room. C. Put the bed in low position as you move the patient onto the stretcher from the bed. D. All of the above. Correct answer, B. Use a safety belt or strap on the patient throughout their escort to the operating room. A nurse must place a safety belt or strap on the patient throughout their escort to the operating room in order to prevent the patient from falling. This type of safety belt is not treated as a restraint because it is a routine part of care when using a stretcher. The bed must be in the high position so it is level with the stretcher when you are moving the patient from the bed to the stretcher. It is very important that you lock the wheels of a stretcher and a wheelchair before you transfer a patient into or onto it. Falls occur when a nurse fails to lock these pieces of equipment. 67. All hospitals and nursing homes are mandated to have the goal of a restraint-free environment. The best way to achieve this goal is to underscore: A. Ban the use of all restraints under all circumstances. B. Limit restraints to only those situations when falls cannot be prevented. C. Keep all bedside rails up for all patients during the nighttime hours. D. Use no skid socks and sheets to prevent falls from chairs. Correct answer, B. Limit restraints to only those situations when falls cannot be prevented. All hospitals and nursing homes are mandated by CHCAHO and state departments of Health to have the goal of a restraint-free environment. This does not mean that no restraints can ever be used under any circumstances. It means that all healthcare facilities must have this as a goal. In order to move toward the goal of a restraint-free environment, restraints should be used only when all preventive measures have failed and the patient is in danger of injury. When a restraint is necessary, the hospital or nursing home must use the restraint that is least restrictive to the patient but can also prevent injuries. 68. Which of these devices is considered a protective device, rather than a restraint? A. A mitten on the hands to prevent scratching. B. A mitten on the hands so the person cannot pull their fore out. C. A side rail to prevent the patient from falling. D. A soft wrist restraint to prevent the patient from pulling their fore tubing. Correct answer, A. A mitten on the hands to prevent scratching. Hand mittens to prevent scratching are considered a protective device and not a restraint. However, when the same mittens are used to prevent a person from pulling their fore out, it is considered a restraint. The same is true for the side rail and the soft wrist restraint. 69. Restraints are sometimes used for what patient conditions or situations? A. Punishment when the patient is uncontrollable. B. To prevent the patient from pulling their fore out. C. When a patient is a danger to self and others. D. All of the above. E. Both B and C only. Correct answer, E. Both B and C only. Restraints are sometimes used to prevent a patient from pulling their fore, or another life-saving tube, out and when the person is a serious danger to themselves and or others. Restraints are never used for punishment. 70. The chain of infection includes the underscore. A. Germ, agent, reservoir, exit portal, mode of transmission, entry port, and susceptible host. B. Active natural, active artificial, passive natural and passive artificial. C. Opportunism, weakness, immunity, and colonization. D. Intrinsic, extrinsic, internal and external transmission. Correct answer, germ, agent, reservoir, exit portal, mode of transmission, entry port, and susceptible host. The chain, or cycle, of infection includes the germ or microorganism, the reservoir, the exit portal, the mode of transmission, the entry port, and the susceptible host. The types of immunity, not the chain of infection, include active natural immunity, active artificial immunity, passive natural immunity and passive artificial immunity. It is important to learn the cycle, or chain, of infection so you can stop the spread of infection by breaking one or more of these chains. For example, you will break the chain of infection when you stop the mode of transmission by washing your hands. 71. Asepsis is defined as underscore. A. The absence of all microorganisms. B. The absence of disease-causing germs. C. A urinary infection. D. A pathogenic infection. Correct answer, B. The absence of disease-causing germs. Asepsis is defined as the absence of disease-causing germs. It is surgical asepsis that is defined as the absence of all microorganisms, including spores. A pathogenic infection is an invasion of the body by a pathogen, or disease, or germ, and a urinary infection is only one type of infection. 72. Mary T. was admitted to a nursing home on May 1. On July 4, she was diagnosed with a skin infection. This infection is considered a underscore infection. A. Nosocomial. B. Systemic. C. Resident flora. D. Resident aura. Correct answer, F. Nosocomial. This infection is considered a nosocomial infection. A nosocomial infection is defined as one that is not present upon admission to a healthcare admission, but instead, occurs during the time that the patient or resident is in the hospital or nursing home. Nosocomial infections are a major problem within our hospitals, nursing homes and other healthcare facilities. Infection control procedures aim to prevent and stop the spread of nosocomial infections. Case Study 3. The nurse assumes care of a 76-year-old client postoperatively following a partial small bowel resection on post-op day 1. Exhibit 1 Vital signs at 1622. Vital signs: T 99.0 degrees Fahrenheit, 37.2 AF, BP 158/90 mmHg, HR 102 BPM, RR 22 breaths/minute, pulse oximetry 96%, pain 0.8. 73. During the nursing rounds, the nurse reviews the client's vital signs. Which prescription does the nurse follow after reviewing the client's vital signs? A. 975 mg acetaminophen PO/PRN mild pain or fever. B. 2 mg morphine for PRN moderate pain. C. 6 mg morphine for PRN severe pain. D. 5 to 325 mg oxycodone/acetaminophen PO/PRN moderate pain. Correct answer, C. 6 mg morphine for PRN severe pain. 8 out of 10 on the numeric pain scale indicates the client is experiencing severe pain. Therefore, the appropriate prescription to follow to treat the client's pain is to administer 6 mg of morphine via the 4 route as prescribed for severe pain. Pain equal to or greater than 8 is considered severe on the numeric scale. In addition, the client's vital signs reflect the presence of pain. The client is hypertensive and tachycardic. Both are indications of pain. Answer A is incorrect. The client does not currently have a fever, and the client's pain is rated as severe, 8/10 pain. The order to administer acetaminophen reads for mild pain or a fever. Mild pain is rated as less than 5 on the numeric pain scale. The client's blood pressure and heart rate also are reflective of pain. Answer D is incorrect. Oxycodone/acetaminophen is prescribed for moderate pain, not severe pain. 74. The nurse administers the client's analgesia and returns shortly afterward to re-evaluate the pain. The nurse notices the client's eyes are closed, and when the nurse calls for the client, they do not respond. Which is the best response by the nurse? A. Run to get the code cart. B. Prepare the client to go to CT. C. Observe the client's respirations. D. Allow the client to rest. Correct answer, C. Observe the client's respirations. The appropriate response by the nurse is to observe the client's respirations. Medications such as opioids for pain management can interfere with the client's respirations and lead to respiratory depression. The older adult can be especially challenging to manage pain appropriately. They can experience a delay in the metabolism and excretion of medications and can be more sensitive to opioid medication. Therefore, the nurse should monitor the client closely when administering medications such as morphine for pain. The nurse always remembers to assess the client's airway, breathing, and circulation with any change in the client's condition. 75. Exhibit 2 verbal prescription from the surgeon. Administer 0.4 mg naloxone for now and Q 2 to 3 minutes PRN for a total of 3 doses. The nurse determines the client's respiratory rate is 10 breaths/minute, applies oxygen, and immediately contacts the surgeon. Which of the following actions does the nurse prioritize next after receiving the prescription? A. Set up suction at the bedside. B. Insert a second 4 catheter. C. Request clarification regarding the prescription. D. Reevaluate the client's respiratory rate. Correct answer, set up suction at the bedside. The administration of naloxone can induce vomiting, and the client who is drowsy with a decreased mental status is at greater risk for aspiration. Having suction equipment available is important to clear any unwanted secretions from the airway quickly to prevent the complications of aspiration. Answer C is incorrect. The nurse does not need to request further clarification of the prescription. The order is complete and provides a dose, route of administration, for, and when to administer the medication, now. In addition, the medication is an appropriate medication to order, an opioid antagonist prescribed to effectively reverse opioid overdoses, which is a potential complication in the postoperative client. Answer D is incorrect. The nurse does not need to reevaluate the client's respiratory rate before administering the naloxone. The nurse suspects the client is experiencing an opioid overdose and, therefore, needs to administer naloxone to reverse the symptoms. Until naloxone is administered, the client's drowsiness and respiratory status will remain unchanged. Therefore, an additional assessment is unwarranted. The nurse first needs to anticipate potential complications from administering naloxone, such as vomiting, and set up suction to avoid aspiration. Congratulations! You have completed the test. Don't forget to like this video and subscribe to our channel for more resources.